Hi everyone, Jennifer Johnson here with Dr. Neil Herendine. We're talking about telemedicine today. Lots of questions, obviously, in our community about that. You know a thing about it. You've been specializing in a lot of different things, but you've been working in this field of telemedicine for years now.
So everybody's heard of telemedicine in one form or another. We've actually been doing it for 20 years here. We've done over 15,000 visits. So we wanted to bring this to people now because more doctors' offices, more patients are looking to keep social distancing and have telemedicine be an option for what would be maybe a routine visit or even a mild sick visit. And there's a lot of things we can do. So the one thing we want to talk about is there's different forms of telemedicine.
Okay.
Today we're talking about video conference only. So if you've used telemedicine before and you've had somebody look in your ears or do a rapid strep or listen to the lungs, we're probably not going to be offer that during the current situation. So we're talking telemedicine video conference only. Compare it to FaceTime. You've all done FaceTime, so it's very similar. In the medical field, we have to have a secure link. So there's a different platform that we use. There's a different connection to make sure that it's still secure and no one can hack into the information while you're talking to your provider. So what we want to be able to do is convert many visits as we can currently to still meet your healthcare needs without having you physically come into the hospital or your doctor's office. So you may be getting a call this week about we don't want you to come into the office because of social distancing, but we want to be able to talk to you about your child or your own personal needs.
We want to stress too that normally in before all of this you would have a certain day and time for your appointment. We want to stress that that is going to continue even with these types of visits.
Right. So step one is to get an appointment. So if your doctor's office is calling you and offering a telemedicine visit, there's two types we're offering currently. One is a telemedicine visit where we're video conferencing. You can see each other, you can show parts of your body, you can have them look at your face. The other is a telephone or telehome visit, and that one would be just a phone call. Both of those are options. Some of the advantages, disadvantages. If it's just a phone call, you're talking about counseling, you can talk about your history, you can do a lot of enhanced things over the phone, that's fine. If you really feel like you need to show face-to-face, telemedicine might be a better option. But in order to do that, we've got to get you at home to be able to interface with us in the doctor's office.
Zoom.
So the platform we're using right now is called Zoom. You can go onto your phone and go to your app store, type in, search for Zoom, and it will show a couple of options, but it's Zoom Cloud Meeting is the version we want you to click on. You download it onto your phone, and then you need to talk to your doctor's office. So your doctor needs to set up a meeting. So that's something that they'll create a meeting ID number. It's a 10-digit number, just like a telephone would be. And what that gives you is a specific time and a specific provider to talk to, just like your appointment. But instead of driving to the doctor's office, you can just pull up your phone at 2 o'clock, type in your Zoom app, type in the 10-digit code that your provider will provide to you. They'll send it out to you ahead of time. And when you go on, you click in that meeting, and hopefully your doctor will be ready to see you right at the agreed upon time. If not, give them a few minutes. They can still connect back to you. So stay online if they're not right there at the time you click on, and they should be asking you to join a meeting. So when you click on the option of join a meeting, it's going to say what meeting do you want to do, and that's the 10-digit code that your doctor's office will provide.
And you're right, the people might not be there exactly as we navigate this new world. So
I think all doctors are always on time and always hit their appointment time, so yes, we'll be there right at the agreed upon time.
One other thing I want to mention too is that consent form is typically a portion of this, and I know you have it here. If we were doing this face-to-face, you'd be able to sign it.
So in course of paperwork in government, they've figured out that we need to do consent, that you understand this is not the same as being in person. But telemedicine is a good option for you. So we'll ask you probably to verbally tell us that, yes, you agree that this is a telemedicine visit. I understand that you can't touch me, you can't do certain tests on me, but it's an okay visit for us to do today. And if somehow we lose connection, we'll pick up the phone and call you. So it's not the end of the world. If for some reason the video goes out, we'll be able to call.
All right. Good.
So if you have that visit, it's going to be time limited, so it won't be open-ended that you can talk all day. You'll still have a specific time period that you need to finish the visit in. Otherwise, the Zoom will tell you your meeting is up and ask you to click off. And then, big question, if you can't load the Zoom app on your phone, you're having troubles with any of the technology part of it, call your doctor's office. they'll have somebody that can help walk you through that. And then hopefully this will be a short-lived for the next few weeks or months, but it's also something that we've been doing for 20 years. So this is not second-class medicine. These are things that your provider should be very comfortable with.
We hope that's helpful in these very different times. Thanks so much.